Hi everyone, from an extraordinarily sunny Bristol. I was not expecting that. Thank you, Mark, very much for inviting me. A great honor to be here to discuss what is, in fact, very sort of work in progress project for me. So feedback very welcome. I've just literally started to sort of wrap my head around these concepts. So as a medical humanities scholar with a literary background, I was surprised to notice how the utter uncertainty of the pandemic in its early days had somehow sparked an interest in literature and in its non-scientific models of managing medical emergencies on a large scale. I don't think I've ever seen so many recommendations for Albert Camus' The Plague. You have a few examples here on the slide. And this is a novel originally published in 1947 about a fictional pestilence in French Algeria. And apparently publishers struggled to keep up with the demand during the months of national lockdowns. The Plague has been interpreted as an allegory of France under Nazi occupation, or more in general, as an existentialist reflection on the absurdity of modern life. There are, however, glimpses of hope throughout the novel, and this is probably what readers were looking for in those early months of 2020. But as noted by Ahmed Kabel and Robert Philipson, the anti-fascism that was important for Camus in occupied France is largely immaterial to his Algerian politics. For those of you who haven't read the novel, spoiler alert, the entire focus of this novel is on the population of European colonizing origin, especially men. The epistemic erasure of the Arab population and of women was apparently of no concern in this revival of interest in the plague. And this attitude runs parallel to the concept of COVID as a great equalizer. But in Cabell and Philipson's words, the emerging class of essential workers under duress have no or little choice except to continue to sell their labor power to sustain life for themselves and for others, and in the case of medical staff, at great risk of losing their lives. This new working class is doubly exposed, at one and the same time exposed to the virus and susceptible to capitalist disposability. So this goes hand in hand with gender-based discrimination, as the COVID crisis deepened gender inequality and intensified gender-based physical and sexual violence. So think twice before recommending The Plague. The reason I've mentioned this example of how the coronavirus pandemic had interacted with literary studies is to highlight to what extent, vis-a-vis the vacillation of the omnipotence of biomedicine in the first months of the pandemic, to what extent recurring to humanistic forms of knowledge in a cursory way has often led to an oversimplification and romanticization of the globalized illness experience. The humanities are perceived as a supportive friend, while they could more appropriately be a critical tool to pose important questions about key factors that affect the illness experience, such as race, class, gender, ability and disability, modes of agency, and so on. So in my presentation today, I'd like to show you a few examples, however sketchy, of more critical humanities inquiries on the narrative legacy of the pandemic. Starting from fake COVID-19 narratives to more literary examples, and also some from Italy to connect with Silvia's thought. So during the first months of the coronavirus pandemic in Europe in spring 2020, I was nearing the end of my research project, Illness as Fiction, Textual Afflictions in Print and Online, which I'd started in 2018, thanks to a British Academy Leverhulme Small Research Grant. And you can see a screenshot of the project blog here, and fingers crossed, the results should be published soon in a special issue of Literature and Medicine. So in a nutshell, it is a project about factitious disorder, previously and popularly still known as Munchausen syndrome, for which I analyzed fake illness narratives published as memoirs or circulated through social media. Who could have imagined that fake would have been one of the adjectives most associated with coronavirus? From negationism, denying the existence of the pandemic to core, to the spread of misinformation, especially in coincidence with mass vaccination campaigns. And of course, we've had some fake COVID-19 narratives. Maybe some of you followed the story of Science in Bi on Twitter in spring, summer 2020. And Science in Bi was the pseudonym of a queer Native American anthropology professor at Arizona State University, who revealed that she had contracted COVID after being forced to teach on campus until April. And then over summer, her death was announced on Twitter by her friend Beth Ann McLaughlin, a neuroscientist at Vanderbilt, who also held an online memorial for her. But at this point, Arizona State intervened and revealed that this appeared to be a hoax. And after close scrutiny of Science in Vi's social media presence over the past couple of years, it became clear that this was, in fact, a fake account, a so-called sock puppet created by McLaughlin herself. Psychiatrist Mark Feldman, the world-leading expert on Munchausen by internet, highlighted how coronavirus and isolation facilitated the spread of online fake narratives of COVID, given the easiness of constructing fake identities online in a historical moment when people could not meet face-to-face. He declared that in 2020, he heard about a new case of fake COVID-19 narratives every couple of weeks. So McLaughlin came up as a very controversial figure, and this is a good moment to remind you that I'm a literary scholar, so I work with texts and in the broader sense, of course, but when I mention real people, I can really only comment on their textual productions, and I can't really delve into psychiatric diagnosis or criminal aspects of these stories. So McLaughlin funded Me Too STEM to tackle the issue of sexual harassment in STEM research, but apparently she was hostile to the presence of women of color in her organization. Her sock puppet Science in Bi was very vocal about her Native American heritage, and this aspect was highlighted in McLaughlin's concern over her work condition during the pandemic. She wrote, "Campus closed and she was in hospital a week later. Be mad about COVID, but me more mad that BIPOC community is most vulnerable and underrepresented on campus. We are killing them." So playing devil's advocate here and focusing on the performative aspect of this kind of tweet, one could be tempted to speculate that this story could indeed raise awareness of BIPOC discrimination on the workplace. But in actual fact, it was rightly condemned as an example of digital red face with worrying public health consequences. As Anna Wakeman observed, these hawks of forced to teach died of COVID hit the news right as university admins were making decisions about reopening and seemed to invalidate legitimate fears about returning to in-person teaching. So in the meantime, other fake COVID-19 narratives have been reported in scientific studies. You can see an example from Israel here. This is a 17-year-old girl with a history of psychological distress who claimed that she had infected herself with COVID-19 by reusing the thermometer of a COVID-19 patient. And the study concludes that in her case, her factitious disorder was apparently motivated by an unconscious need for emotional support, which is a very common motivation in Munchausen, and which can only be exacerbated during a pandemic outbreak with its lockdowns and quarantines. Now, I teach a module on illness narratives to third-year English students, and in its 2020 and 2021 iterations, I felt it was appropriate to start with COVID-19 narratives. And you can see an example here. This is by Esme Wei-Jung Wong, named as one of the best young American novelists. She's most famous for her bestseller, The Collected Schizophrenia, published in 2019. Now, this one here is a short story about her own experience of the pandemic, which we could describe as autofiction. In Hugh Dick's words, autofiction is a form of autobiographical writing that permits a degree of experimentation with the definition and limits of the self, rather than the slavish recapitulation of known biological facts. The short story here describes the similarities between collective aspects of living through a pandemic and her personal experience of Lyme disease, which is one of the so-called contested diagnoses on which there is not medical consensus yet. Wang half jokes that she's been preparing for a moment like this for years. She writes, remaining at home in bed for days or weeks at a time was my way of being. But she also shares her experience of navigating medical uncertainty. Let me read a lengthy but poignant quotation. During the worst, most excruciating bouts of discomfort and pain, for example, I would need to contend with the idea that it was entirely possible that I would be exactly that sick forever. I wouldn't die, thereby releasing me from the wreckage of my body, which had grown bony and weak. I would just be that sick, and there would be nothing I could do except to keep taking my medications and supplements, which might not be doing anything at all, and to drag myself to the clinic, where I was trying a variety of treatments that I was sure, most of the time, were not doing anything more useful than a silent drip might. That was uncertainty, to have absolutely no clue and no proof that what I was doing was having any effect at all, and to not know if I was carrying up my veins for no reason other than to indicate to myself that I had not yet given up on life. You will recognize here some key concerns in the public discourse during the worst month of the pandemic. The difficulty of processing its distorted temporality, the faltering trust in biomedicine, the stubbornness of not giving up on life anyway. Wang's short story ends on an uplifting note, but between the lines, she reminds us that we shouldn't have waited for a pandemic to reflect on our vulnerability, on the limits of biomedicine, and on our being de facto global health citizens. These are all lessons we could have learned by paying more attention to traditionally marginalized patients whose illness experience does not conform to the restitution narrative of getting ill, getting treatment, and recovering. But let's have a look at Italy now. Silvia has reminded us that Italy was the first European nation to be significantly affected by COVID-19. And during the peak of the pandemic, Italy's number of active cases was one of the highest in the world. Interestingly, prize-winning Italian novelist and physicist Paolo Giordano published Nel Contagio, see here, literally it means, within the contagion, and an instant book, or rather an instant essay. So this was published at the end of March 2020, and it was later translated into English as How Contagion Works. It is an accessible text. You have the novelist with the scientific background trying to explain the maths behind epidemiology, concepts like exponential growth or R value, which would sadly become very familiar in only a few weeks' time. However, among the pages of an eminently didactic text, we still get a glimpse of Giordano's personality. It is fascinating how he admits that math exercises have long been a source of comfort to him, and so much so during the pandemic. He writes, epidemics are mathematical emergencies first and foremost. But the pandemic also contains a more complicated view of science. In the contagion, science has disappointed us. We wanted certainties and we were given opinions. We forgot that this is how it always works, that it can only work like this, that for science, doubt is even more sacred than truth. Right now, we don't care. We're looking at experts bickering among themselves like toddlers, watching their parents fight. And then we start bickering too. So Giordano highlights here how the pandemic has challenged the whole concept of expert knowledge and authoritativeness. The discovery of a heightened bodily vulnerability, emphasizing an equally concerning epistemological vulnerability. I'll briefly mention another more distinctive narrative instant book published in April 2020, Andrà tutto bene, Everything is Going to Be All Right, which is a collection of 26 short stories by different authors. You see their names on the cover here. And its proceeds were given to one of the hospitals most affected by the pandemic. The title of the collection references the slogan of reassurance, so popular in Italy during lockdown. You can see the banners here on, it's kind of iconic images by now, banners on balconies created by Italian children with this slogan. Andrà tutto bene is a very eclectic collection in which each author reflects on different aspects of the pandemic according to the usual style and genre. So you have detective fiction, all sorts of possible genres there. But it also includes a letter to Italy by American author Gianpaolo Lahiri, who has lived in Italy and now writes in Italian too. And after reporting comforting email exchange with her Italian publisher from her home in the US, Lahiri states that the Italian lockdown lets those who are outside of it believe that we are somehow protected, but it isn't true. Over the past few days, we've all become forcibly Italian, and what is happening there is rapidly spreading everywhere. The coronavirus that temporarily separates us has dismantled all boundaries, all distances. So Lahiri operates within a globalized literary market, but also senses how other forms of global interconnectedness surfaced during the pandemic. And last but not least, I'd like to tell you about a book that has benefited from a slightly longer gestation, Come il mare in un bicchiere, like the sea in a glass, by Chiara Gamberale, published in June 2020. And this is explicitly presented as an autofictional revision of this writer's journal during lockdown. We learn about her mental health issues, her relationship with her toddler daughter, her phone calls with a network of friends that count as family, but not according to the latest government decree. There is a tendency throughout this book of adulterating, I'd say, the experience of lockdown a bit. The slowing down of otherwise frenetic working rhythms is welcomed, as well as a rediscovered peace of mind. And of course, multiple layers of privilege subtend this positive experience of lockdown. But Gamberale reflects quite honestly on how retreating from society can, in some cases, alleviate psychological distress. Near the end of the book, she confesses, "I'm afraid that when the world heals, I will get ill again." And this sentence is at the top of a blank page on which she invites her readers to write down their own shameful thoughts during the pandemic, the shameful thoughts they had during the pandemic. So I'd like to conclude with a quotation from psychiatrist Bradley Lewis on the role of the arts and humanities in a post-pandemic world. Responding to COVID times at its heart means waking up to the need to live differently at a fundamental level. Continued environmental devastation and injustice will bring continued risk zoographies, continued pandemics, and continued damages to human health through climate change, biodiversity loss, undernutrition, contaminated water use, and soil degradation. This makes it imperative that we reorganize our value systems towards more sustainable definitions of well-being and the good life. There are many ways this might be done, but orienting the arts and humanities towards this goal is an invaluable resource that should be mobilized in this direction. Thank you.